Hypothyroidism is an endocrine disease. Look at this picture, shows that thyroid gland and goiter. Look at this ultrasound findings. Detail going on. Introduction. Hypothyroidism is a condition in which the thyroid gland fails to produce adequate levels of thyroid hormones, primarily thyroxine T4 and triiodothyronine T3. These hormones regulate various metabolic processes in the body. The insufficient thyroid hormones are produced. The body's metabolic functions slow down, leading to a range of symptoms. Hypothyroidism is more common in women, especially those over 60, and can range from mild to severe forms. Definition. Hypothyroidism is defined as a clinical condition resulting from the deficiency of thyroid hormones, leading to a generalized slowing of the body's metabolic processes. The thyroid hormones T3 and T4 are produced in the thyroid gland and are crucial for normal development, energy metabolism, and overall well-being. Types. 1. Primary hypothyroidism. The thyroid gland itself is unable to produce sufficient hormones. This is the most common type. 2. Secondary hypothyroidism occurs due to the failure of the pituitary gland to produce enough thyroid stimulating hormone TSH, which regulates thyroid function. 3. Tertiary hypothyroidism, a result of hypothalamic dysfunction, leading to insufficient release of thyrotropin releasing hormone TRH, which in turn fails to stimulate the pituitary to release TSH. 4. Congenital hypothyroidism, present from birth due to thyroid gland malformation or dysfunction. 5. Subclinical hypothyroidism, a mild form where TSH level are elevated but thyroid hormones level is remain normal. 6. Iatrogenic hypothyroidism, caused by medical treatment like surgery or radiation therapy, targeting the thyroid gland. causes. Autoimmune diseases. Hashimoto's thyroiditis, where the immune system attacks the thyroid gland, is the most common cause. Two, iodine deficiency. Iodine is necessary for thyroid hormone production and its deficiency can lead to hypothyroidism. 3. Thyroid surgery. Removal of the thyroid gland for cancer or hyperthyroidism can lead to hypothyroidism. 4. Radiation therapy. Radiation treatment for neck, chest cancers can damage the thyroid. 5. Medications. Certain drugs such as lithium, amiodarone can affect thyroid hormone production. 6. Pituitary disorders. Issues with the pituitary gland can lead to insufficient TSH production causing secondary hypothyroidism. 7. Congenital condition. Some babies are born without a properly functioning thyroid. 8. Thyroiditis. Inflammation of the thyroid gland can result in either overproduction or underproduction of hormones. Risk factors. 1. Gender. Women are more likely to develop hypothyroidism. 2. Age. Old adults, especially those over 60, are at high risk. 3. Family history. A family history of thyroid disorders increases the risk. 4. Pregnancy. Postpartum thyroiditis can occur after childbirth. 5. Autoimmune disorders. Individuals with other autoimmune conditions like type 1 diabetes or rheumatoid arthritis are at increased risk. 6. Iodine deficiency or excess. Both insufficient and excessive iodine intake can disrupt thyroid function. Complications. 1. Goiter. Enlargement of thyroid gland due to overstimulation by TSH. 2. Cardiovascular problems. Hypothyroidism can lead to high cholesterol, atherosclerosis, and heart disease. 3. Infertility. Low thyroid hormones levels can interfere with ovulation and fertility. For mental health issues, depression, memory problems, and slowed mental functioning are common. 5. Myxedema, coma. A life-threatening condition with extreme hypothyroidism leading to hypothermia, heart failure, and coma. 6. Developmental delay in children. congenital hypothyroidism can result in growth retardation and intellectual disabilities if untreated. Pathophysiology. Hypothyroidism occurs when the thyroid gland is unable to meet the body's metabolic demands due to the inadequate production of thyroid hormones T3 and T4. The decrease in thyroid hormones affects various organs and systems. 1. Metabolism. Slow down, resulting in reducing energy production, weight gain, and cold intolerance. 2. Cardiovascular system. Reduces heart rate and cardiac output, contributing to bradycardia, high cholesterol, and hypertension. 3. Nerve system, leading to lethargy, memory impairment, and depression. 4. Musculoskeletal system, causes muscle stiffness, joint pain, and slow reflexes. In primary hypothyroidism, elevated DSH levels attempt to stimulate the thyroid gland to increase hormone production, often resulting in goiter. The pathophysiology of hypothyroidism involves a step-by-step process that explains how the deficiency in thyroid hormones affects the body's metabolic and physiological functions. Here is a breakdown of the step-by-step process. One, failure of thyroid hormone production, primary hypothyroidism or secondary hypothyroidism, tertiary hypothyroidism. 2. Reduce thyroid hormones T3 and T4 in the bloodstream. 3. Feedback mechanism failure. 4. Slower metabolism. 5. Effects on cardiovascular system. 6. Effects on gastrointestinal system. 7. Neurological and cognitive effects. 8. Musculoskeletal effects. 9. Accumulation of glycosaminoglycans. 10. Reproductive effects. 11. End result, hypothyroid state. The combination of these systemic effects result in classic clinical presentation of hypothyroidism, including fatigue, cold intolerance, weight gain, dry skin and hair, depression, bradycardia, constipation, puffy face, and extremities, myxedema. The step-by-step process outlines the systemic effects of thyroid hormone deficiency and how it manifests in the various systems and complications of hypothyroidism. Signs and symptoms. 1. Fatigue and weakness, a common and early symptom. 2. Weight gain, unexplained weight gain, due to slowed metabolism. 3. Cold intolerance, feeling cold even in warm environments. 4. Dry skin and hair, skin become dry and hair may thin, become brittle. 5. Constipation, slowed gastrointestinal motility. 6. Depression and cognitive decline, mood swing, memory loss and depression. 7. Bradycardia, slow heart rate. 8. Menstrual irregularities, heavy or irregular periods. 9. Hoarseness, a hoarse voice due to slowing of the voice cords. Diagnosis: 1. Thyroid function test, measurement of TSH and free T4. 2. Anti-thyroid antibodies, detection of antibodies against thyroid peroxide in autoimmune hypothyroidism. 3. Thyroid ultrasound helps evaluate the structure of the thyroid. 4. Radioactive iodine uptake test assesses how the thyroid absorbs iodine, which may help in identifying causes like Hashimoto's thyroiditis. In nursing diagnosis: 1. Fatigue related to decreased metabolic rate. 2. Imbalanced nutrition, more than body requirements related to reducing metabolic rate. 3. Constipation related to slowed gastrointestinal motility. 4. Impaired skin integrity related to dry skin. 5. Disturbed thought processes related to cognitive dysfunction. In management, medical management: 1. Thyroid hormone replacement, levothyroxine is the standard treatment. To normalize thyroid hormone levels, the dose is adjusted based on TSH and T4 levels. 2. Dietary adjustments, encouraging a diet rich in iodine if iodine deficiency is a factor, but avoiding excessive amounts. 3. Monitoring, regular blood tests to assess TSH and T4 levels for optimal medication adjustment. In nursing management: 1. Monitor vital signs, check for bradycardia and other cardiovascular symptoms. 2. Education, teach patients about medication adherence, potential side effects, and the importance of follow-up blood test. 3. Skin care, provide recommendations for moisturizing dry skin. 4. Dietary support, encourage a balanced diet with adequate fiber to help with constipation. 5. Emotional support, help patients cope with mood changes, and cognitive issues. Treatment: levothyroxine, synthetic T4, and standard treatment is taken daily. 2. Levothyroxine, a synthetic T3, may be used in combination with levothyroxine in some cases. 3. Desiccated thyroid extract, an alternative treatment using thyroid extract from animals, though less commonly prescribed due to dosage variability. Psychosocial medicine. Hypothyroidism can affect mental health, contributing to depression, mood swing, and cognitive difficulties. Psychosocial interventions may include: 1. Support groups, encouraging participation in hypothyroidism support groups. 2. Mental health counseling, referring patients to counseling for managing anxiety, depression, or other psychosocial concerns. 3. Patient empowerment, educating patients to be proactive in managing their condition to reduce the psychological impact. Prevention: 1. Adequate iodine intake, ensuring sufficient dietary iodine, especially in regions with iodine deficient soils. 2. Screening, early screening in at-risk populations such as pregnant women, the elderly, and those with family history of thyroid diseases. 3. Regular monitoring for individuals on thyroid affecting medications or with a history of thyroid disorders. In conclusion, hypothyroidism is a manageable condition with proper medical care, medication, and lifestyle modifications. Early diagnosis and treatment are crucial to preventing complications and improving quality of life. Patient education, adherence to treatment, and regular follow-ups are essential components in managing hypothyroidism effectively. Thank you. Have a nice day.